In every community, there is work to be done. In every heart, there is the power to do it. Nearly 1 in 5 people under the age of 65 are without health insurance in America. In Wisconsin, a state that is doing better than most, 12% of our citizens go without coverage, and in Jefferson and Dodge counties, 13,000 of our friends, neighbors, and family do not have health insurance. You are probably asking yourself, who are the uninsured? They are not very different than you or I. 80% of the uninsured are adults. 80% are either workers or live with workers. 67% are from families earning less than $40,000 for a family of 4. They work for small companies that can't afford to offer health insurance, or they can only offer insurance that is very costly and out of reach for many. They are part-time workers or self-employed. They are between jobs or just out of school. 29% are between 18 and 29. They don't sound that different than you or I. In 2006, a number of our healthcare professionals, along with the Dodge-Jefferson Healthier Community Partnership, came together to do something about this problem. They had seen the faces of the uninsured and knew that something had to be done. They believed that the Watertown community would come together to help their fellow citizens in need, and that a clinic to help the uninsured was feasible. Together, they formed the Watertown Area Cares Clinic Committee. Their belief in the Watertown community was well placed, and in May of 2008, the Watertown Area Cares Clinic opened its doors, providing uninsured residents with access to health care.
When we started to dream about a free clinic in Watertown, we had no idea what the community support would be like, and we were overwhelmed. I think that there are very few people within our community that don't recognize the value of this clinic. It is really widespread appreciation for the service that comes from this clinic, and that's from medical professional people, as well as a lay person who doesn't have an idea about the traditional medical care, business people, just civic-minded individuals. It's outstanding.
This place has far exceeded my expectations. Our location is perfect. Our clinic is inviting, and it's a healthy place to be. It's a place that people want to come to volunteer, want to come for their health care. So we're really lucky. We're really lucky to have that, and it's all from the generosity of the people in our community.
Well, it's been a tremendous experience watching the contributors to the process here. My small part as a clinician, helping with the design of the clinic, really lent me an opportunity to see the great contributions of all the tradesmen in our community and the commitment of people like Harley Harold from the hospital, who contributed untold hours to the process of making this building happen. The finished product speaks for itself in that I don't think anyone would doubt this was a first-class clinic. And I think it's our commitment from the community that we're able to pull together, with all their help, a clinic that's just first class for our patients who don't have the ability to pay for those services.
The fundraising wasn't going as well as we thought it would, so I got involved. I have a lot of contacts with contractors. So I started calling people and just talking to people, and I found that people were willing to step up and really give on their time, as well as their, their gifts in business. I was amazed, because I started calling these people and discussing with these people about what was going on and how important it was, and they all seemed to step up. I've never done this before. I was involved in, okay, let me give you a PO number, and the company comes in and says, okay, now I'll come in and for this much money do your job. And whenever I talked to people, I got on the phone and I said I had to precursor it with saying, I got to ask you a little other question that I'm for free. And once we got into conversing and discussing, and that it was a community event, and how it helped all people, it wasn't just a few people who were going to benefit from it. It wasn't a big business that was responsible for it, but it was the community. These businesses all stepped up.